We were in the first wave of peak infection as New York is. We think that we're in a later wave of rising infections and hospitalizations.
Densely populated major transit hubs are seeing spikes in coronavirus infections, including the nation's capital. But could it become the next New York?
My name is Joshua Sharfstein. I'm professor of the practice in health policy and management at the Johns Hopkins Bloomberg School of Public Health. Cases in the DC region are growing at a rapid pace. Our concern here is for exponential growth, that one person gives it to 2 people, then 2 people give it to 4 people, then 4 people give it to 8 people. In this region, the peak is probably going to be in the next month to 2 months. It's probably going to stay pretty serious after the peak. I think you can have the impression, listening to people sometimes, that once we get to the peak, it's all good after that, and that is not the case.
Leaders in the DC, Maryland, Virginia area fear the pandemic could have a dangerous backlash for the country by keeping the federal workers on the front lines from running the nation's coronavirus response.
A major outbreak among our critical federal workforce could be catastrophic, crippling the national response.
A surge of infections across the area could prevent the government's ability to deliver unemployment checks, small business loans, and safety net services. But one of the things that makes this a little tricky is that there's a delay in seeing the impact of the interventions.
Models are as good as the assumptions you put into them.
We're at a point now where there's a threat that the healthcare system could become overwhelmed, and we don't know for sure what's going to happen because of the delays that could take 2 or 3 weeks to show just how bad it is.
We are in desperate need of PPEs. We are reusing our N95s for days and sometimes weeks at a time.
We've seen from Europe that many cities have been hit extremely hard. And the metropolitan area is really a healthcare system that doesn't usually deal with this volume of very, very sick patients, many of whom need ventilation and intensive care.
Urban centers are experiencing the virus at a different pace, and this could be because of the previous lack of testing and control measures.
It's just about the timing, and any city that hasn't been hit hard has to be very worried that it will soon come. You're particularly worried about communities where people live in closer contact with each other. It's really important to pay attention to those communities and to meet their needs in order to protect the entire city and region from so many cases that the healthcare system gets overwhelmed.
Nobody knew there'd be a pandemic or an epidemic of this proportion. Nobody's ever seen anything like this before.
We had SARS in 2003, and we said, well, we're lucky that it wasn't more contagious. We had H1N1 in 2009, and we said, well, we're lucky because it wasn't that deadly. And now we have a virus that is both contagious and deadly. The DC area has to respond seriously and hopefully can be a model for other parts of the country. It's really important for the DMV that the 3 jurisdictions are planning together and doing consistent actions, because if there are mixed messages that people in the region are hearing, that can undermine the effectiveness of the public health response.
It's too soon to say whether any area really has this under control, and by control meaning life returning to normal.
Unfortunately, we have a lot of difficult days ahead of us before we can really start thinking about that.